It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. I'm Sam Lesante, and what a great show we have for you today. You know, we're talking about the Greater Hazleton Health Alliance, folks, and today we have another new doctor joining us in the Greater Hazleton Health Alliance, and I keep saying it since 1994, folks. There's no reason for any of us to go out of town, especially after you see the show today. And we're going to introduce to you a new surgeon in town, Julio Calderin. It's going to be exciting because there's a lot of new innovative things that are happening in the Greater Hazleton Health Alliance. For example, this is the mission statement. The mission statement says to provide the highest quality of surgical care to patients in a patient-focused atmosphere. And folks, it's the way it is. The Alliance team of surgeons just gets better and better. And today, I'd like to introduce you to a new person on board, Dr. Julio Calderin. Doctor, how are you?
Good, and you?
I'm doing fine. I got a couple pains in my back, but that comes when you hit 50 years old. You know what I mean? Yeah. So what do you take? 2 aspirins and call you in the morning? Is that way how did that ever happen? People say, take 2 aspirins and call me in the morning. Is that the miracle drug or what?
It's been for a while, so even now, vascular surgeons prescribe aspirin, so I guess it's a wonderful drug.
See, I'm on top of things, doctor. You need help in surgery?
Yeah, sure. I can always have a second hand.
Okay. Yeah. Anyway, doctor, listen, it's great to have you in the area, and we'll be interviewing your wife on a future show. But tell us about yourself. You know, who you are and where you come from and why you came to the area.
So I'm originally from Puerto Rico. I did my residency and my basic training in Puerto Rico. Then I decided that I wanted to do more vascular surgery and get into the advancing technology. And I went to Long Island, New York, and did my fellowship in Long Island. I spent 2 years there in a great training place. Then I decided to start working and moved to Texas. In Texas, we work in a hospital in a small community, and we established a program with a cardiologist doing interventional cardiology and all this advance in procedures we can do nowadays with minimal invasive vascular surgery. But at the end, the hospital wasn't growing, and we saw Alliance as a expanding hospital and decided to move here and work with this great service.
Now, it's interesting you should say that because as I interview the doctors, I'm always excited because it does my heart well to see all the great doctors coming into the area, but also bringing a lot of new technology, okay? And you said something, and I wanted to mention you're a vascular surgeon, okay? Yes. So for just educational purposes and elementary, what a vascular surgeon does what?
Traditionally, a vascular surgeon deals with all the arteries and veins in the body, from the base of the neck to the legs. In the past, we used to do open surgery to repair the arteries and the blockage. Nowadays, we do the minimal invasive procedures to fix them, and patients do well, and most of them go home next day after the procedure.
When we look at the procedures, okay, and what you bring to the table, your education, all right, and when you studied and you have a vast background, bringing this to the Greater Hazleton area. Sometimes when many years ago, and I'm talking about many years ago, people felt that they had to go to the big cities, you know, to get qualified. Now, I'm sure there are sometimes if there's brain surgeries or spinal, I'm talking about, you know, not the real extremes, but in your own viewpoint, coming here to the Greater Hazleton area, and welcome to you, you know, coming into the area, I wish you huge success. What do you think you bring, you know, to this area? Well, I mean, why would I want to go to you and say, well, no, I'm going to go to Allentown or Philadelphia or New York, okay? Is there any reason for that?
There was a misconception that all these minimal invasive surgeries needed to be done in the major hospitals in the, you know, like Philly or other bigger hospitals. Nowadays, with our training and the technology, we can do it safely and have the same outcomes at the big hospitals. So we're basically going to bring all that technology and start doing all those procedures here in Hazleton.
What is the most exciting thing that you do? that you
Aneurysms.
Aneurysms. And I have a couple questions on aneurysms, okay? Because those are interesting things. If you just tuned in, folks, I'm talking to Dr. Julio Calderin, who is a new surgeon here, not a new surgeon, but brings a lot of great technology to our area. Now, so when you're talking about aneurysm, what is an abnormal aortic aneurysm?
Basically, your body has a big pipe. The big artery is the aorta. In the chest is called the thoracic aorta. In the abdomen is called the abdominal aorta. Aneurysm is when that artery doubles the size, at least, and usually measure 2 centimeters in every normal person. When it grows more than that, it's called an aneurysm. It has to be 50% more than the original size. And it's caused a dilatation, like when your garden hose gets old, it creates a balloon on it, and that happens into your pipe also.
So your veins you're talking about?
It's
your arteries,
yes.
arteries, okay. They get double the size?
They grow and
like a balloon?
Like a balloon and get weak.
Okay. Okay. So what are some of the symptoms?
When they're growing, they can be asymptomatic or have no symptoms. They can be found incidentally when doing a physical exam. But when they get symptomatic, then it can be suddenly that they burst and people get, sick and pass away. And other symptoms are like the aneurysm can create clot inside, and you can lose your legs or toes because of the embolization, what we call, or the little clots going down the arteries.
So hence, when we say people should go for yearly exams minimum to the doctor,
yes.
okay, the general practitioner or their doctor, there's reasons for that, because I often wonder sometimes why Benyo will be, pushing on my stomach or feeling my legs, or, they do all these different things that I don't think the patient understands what's going on. But I think what they're doing is they're giving you a thorough exam to see if there's anything, correct?
Yes, and they are the first line of defense. They are the ones that are detecting most of the aneurysms, and everything, if you catch it earlier, is easier to treat than just in an emergency when they burst.
So now, what are the causes of the
there's been many causes. The dilatation of the aorta is caused by inflammation. We know that the artery has an elastic wall, and it gets degraded or destroyed with an inflammation. One of the biggest causes is smoking. Smoking destroys the connective tissue, and the artery gets bigger.
Repeat that for me.
It's smoking.
I've been preaching for years. For years. When I see these people smoke, I feel so sorry for them, really, especially if they're addicted, doctor. I mean, and it's not an easy thing. I know so many people try to quit, but, if they only knew the damage that they're doing, I mean, and it's amazing how much education. Here you are telling, thousands of people, smoking is no good for you, okay? It's going to hurt you. And you know what? They're probably smoking a cigarette watching the show. Okay, and I don't know, like, what do you have to do to convince people to understand that they're hurting their body?
Most people, they get sick and then they start realizing that it's not helping them. Nowadays, we're doing better with programs to stop smoking, and we have medications to help you quit smoking. So the first step is just to decide that you want help to stop the habit, and we can help you to achieve that goal.
That's good to hear. Getting back to the causes, okay, you said inflammation, okay? Now, I'm a firm believer, and I take them every day. I take omega-3s every day, the fish oils. And from the studies, I'm under the impression, I know for a fact, by taking good quality fish oils, and I'm not promoting PRN, which is the brand I use, but I find that the fish oils really help in inflammation.
Yes, it's funny that you mentioned that, because most of the problems that we have is also related to our diet. And if we live more like a healthy lifestyle and control our fat intake and eat more healthy food, we probably will avoid most of the disease we're suffering right now.
Yeah. So I'm doing the right thing by taking fish? Okay. Because when I interview doctors, I get free advice.
Yeah.
I don't get a bill. I just get free advice. So anyway, so we're talking about the causes. Okay, now we got them. Okay, so what test would I need?
Basically, the first test is going to be a sonogram of your belly. The sonogram is painless. It's just a probe with a jelly that can measure the size of the aneurysm. It's importantly that the aneurysms are fixed depending on the size. If the aneurysm is smaller than 5 centimeters, we just watch them to see the growth rate. Some people will never need to be fixed. If they get close to 5 centimeters or bigger, we'll fix them. But the first test will be a sonogram.
How do you fix them?
There are two basically methods of fixing an aneurysm. Traditionally, the open repair, when you open the belly and replace the artery with what we call a graft. It's made of a fabric, Dacron, and we just replace the artery. But nowadays, it's going into the minimally invasive procedures, and we fix the aneurysm from the inside with stents.
That's interesting. And once again, the test, so a person really wouldn't know if they have an aneurysm unless if they're getting some pains or
Yes. Basically, the aneurysm is caused by a mass that it has like a pulse in your belly. It's hard to detect if you have a big belly. If you're really thin, you will see it, but most people will never. It will be hard to detect an aneurysm by just simply looking at it. So,
a friend of mine about 4 months ago, had pains in his stomach and he wasn't feeling well, and finally it was so bad that he drove himself up to our hospital up here, and actually collapsed when he got outside. And so when they took him in, immediately they were running X-rays, and one of the surgeons, and I don't know who it was. I know it was it wasn't you because you weren't here, but they immediately did a test and found that he had an aneurysm, a bleeding aneurysm, and it was only a matter of time that they were able to, get him in surgery, and they saved his life. So so it was, I guess if he would have gone sooner, he was experiencing pain in his stomach, and it's indigestion, it's this, it's that.
When you have pain, it can mean that the aneurysm is growing too quickly, and that's a sign of a expanding aneurysm, back pain, belly pain. And whenever you have a symptom like that, you should go to your doctor to check it out. Immediately.
Yeah, don't even. Okay, so how is it treated then?
There are two methods: the open approach and the minimal invasive with stents.
What do you? And that's for you to decide whether it's.
In order to decide if you can use the minimal invasive, you need to have a specific anatomy. Because you need to seal the aneurysm with stents. The stents right now go to certain size, so if you have a bigger aorta, you will not be able to seal it with a stent, so you would need an open repair. So basically, when we detect that the aneurysm is too big with a sonogram, we'll do a CT scan to really measure the size and the anatomy of the aneurysm to decide which method is the best approach to fix it.
Let's move on to carotid artery disease, which I think a lot of people have carotid, arteries or they're corroded or whatever the case may be. What is that?
Carotid artery disease is when your arteries in your neck start getting hard and develop plaque and start blocking the flow to your brain. Most people with carotid artery disease that are symptomatic develop a stroke. It's important to go to your doctor because a primary physician can detect sounds in your neck, like what we call bruits. When you have a sound in your neck, it may mean that there's a blockage in the arteries in your neck, and then we can start checking how bad is the blockage.
Here again, physical exams will detect that.
Yes.
Okay, because that's when they put the thing to your neck and they listen to your if there's a beat or whatever they're listening to.
They listen to your neck and they will find a bruit or if there is any problem.
Okay, so what causes?
It's like what we said before: smoking, eating fatty
Back
food.
to smoking again.
Fatty food and a bad diet, basically.
What's a bad diet?
It's our typically diet we have nowadays with high fats. It's our Western diet, what we call.
Yeah, but I mean, you're talking about the fatty meats.
Fatty meats,
You know,
yes.
and no matter, again, well, I've always been a believer in moderation, doctor.
Yes.
You know, I think if you're moderate, if you don't overdo something, there's always a balance if you do the proper exercises or whatever the case may be. Wouldn't you think so?
I think if some people, it depends also on your genetics.
Yes.
If your body can deal with the load of fat, some people deal it well and never get sick. But some people, even though they develop the problem, so it depends on person to person. So if your friend doesn't get sick, it doesn't mean that you're gonna get sick.
What would be some of the symptoms of a carotid artery?
Basically, when they're getting in the major narrowing the arteries, you can develop what we call transient ischemic attacks. It's when you feel tingling, weakness in one side of your body. You have slurred speech, and the worst symptom is going to be a stroke or a mini stroke.
Mm-hmm. Now, in order to, and again, it could be through inflammation in the different areas.
Cholesterol and smoking.
All right. So, what would be the test?
The test will be again a sonogram, a carotid Doppler. It can predict easily the narrowing in your arteries. Depending on the narrowing, then we'll address the situation.
Mm-hmm. So then how do you treat it?
Carotid disease is treated depending on the blockage. We measure the blockage in percentage. If it's less than 50%, we just treat it with an antiplatelet like aspirin.
Take your aspirin and call me in the morning.
Yes.
Keep telling you that.
If it's more than 60%, there are many studies that has supported the early repair of the carotid disease to prevent strokes and disability in long term.
Folks, if you just tuned in, I'm talking to Dr. Julio Calderin, not a newcomer, but new to the Greater Hazleton area. The surgical services team, folks. You want to call him and ask any information, it's 501-6900. He joins a great team, folks, a surgical team, and when you get this, when you find out about their surgical services, it's just amazing. And the doctors here, Bono, Butt, and then we'll be introducing your wife to the area, Sandra Dennis, who is a board-certified general surgeon. Hey, how'd you meet your wife?
In residency.
Yeah, residency.
Yeah. Yes.
So she's a pretty good-looking girl, I
Yes.
see. Yeah, and so then, and you have a little baby.
Yes, 9 months.
What's her name?
Elena.
Elena. Okay.
Yes.
And so when you looked around, you said, for the sake of people coming through the channels, you said you went to Texas and you decided that. What attracted you to come to the Greater Hazleton area, particularly to the Hazleton Health Alliance?
We train in Long Island, so we knew about the East, and we like the weather and the difference in culture, the mix of cultures in the Northeast. And when we got a meeting with the hospital, we saw that the hospital is growing so fast and has all these great physicians. So it was a no-brainer to move here.
And that's interesting because you see, I think some people think when you're going to practice, mm-hmm. and I see you're passionate about what you do, and that's great, doctor. You want to make sure you're coming into an area. I'm sure your wife looked at the different areas and said, well,
mm-hmm.
they have schooling and education or whatever, but not for a job, but for a career.
Yes.
And that's we hope that we're bringing people like you in who are, advanced in technology. It's a good thing. It's a good feeling. Vascular surgeon. Now, why did you decide to become a vascular surgeon?
When I finished my residency, I trained in Puerto Rico, so we didn't have the advanced technology that nowadays is currently in the States. So I wanted to treat aneurysms. That's because it's a very challenging disease. When they rupture, you have no time to deal with those, and you have to act quickly. With the advancing technology, we can save a lot of people by early detection and fixing them.
And that's always the key of early detections. I mean, there's, does it happen in, what higher percentage of age groups do aneurysms happen? Is it over 50, over 40?
Over 60, most likely is males. It's more, the incidence is more in males than in females, and smokers.
Yeah. We're back to those again. If they
Yes.
only understood what the smoking can do. Man, I'll tell you. So over 60, male, okay, so basically to try to prevent any carotid arteries or any, is the physical checkups.
Yes,
And
physical
especially-
checkups. And if you have a family member that was diagnosed with an aneurysm, there's some genetic predisposition for them, and you should be checked also by the age of 50 at least.
And once again, what would be the normal, you know, if
Just a sonogram. It's a physical exam.
that's if the doctor detects something or if you're complaining of
Yes,
something.
if you're complaining of something.
And the success rate has been, how's the success rate?
The success rate when they are done electively is high. It's like more than 90% people do great. With the minimal invasive surgery, they go home probably in 2 or 3 days. With the open surgery, they stay in the hospital from 4 to 7 days. If they come to the emergency room with a rupture aneurysm, 50% don't make it out of the hospital.
That's sad. Okay. Now going back to Puerto Rico, when little Julio was running around the streets and he was going to school, I always wanted to find out, like people say, well, why do you go on television? Why do you do this? Okay. So you had to have something had to click in your mind to say, you know, I think I'm going to be a doctor.
Yeah, it's funny because I decided to be a doctor just by seeing my primary physician. I only knew that there was only one kind of doctor at that time. So then I went to medical school and saw that, oh, there are so many different kind of doctors. And then I just kept studying until I decided to become a vascular surgeon.
Now, your parents, are they any physicians?
No.
So what did they do?
My dad is an accountant and my mom is a housewife.
Yeah. And that's a lot of work. I'd rather be working in labor than be a housewife.
Oh, yes,
okay?
yes.
I like when people say, oh, you're just a housewife. I want to give them a backhand because what these wives do for a day,
It's a lot
forget
of
about
work.
it. I'd rather go into the mines and work, okay?
Yes.
So you decided then by seeing the general physician
Yes.
that you were interested in that.
Yes.
Now, any brothers or sisters in your family?
2 sisters.
Yeah, and what do they do?
One works in a pharmaceutical corporation, and the other one is a teacher.
Are they both in Puerto Rico or are
Yes,
they here?
in
so
Puerto Rico,
So
yeah.
they stayed in Puerto Rico. It's a
Yes.
beautiful place.
It's a beautiful island.
I told you I was there many times. People, I find the people down there so warm. They remind me of Italians to a degree, and the Slovaks and the Polak people that are always family-oriented, close, and want to help people. Maybe a little difficulty. I took Spanish 2 years.
Yeah.
I can't speak a word of English nor Spanish. We went to Spain. I had 2 years of Spanish, 2 years of French, 2 years of Latin. I can't even speak English, let alone. We were in Italy, and I said, what am I doing? I can't even speak. My wife is the one that's fluent, not fluent, but she could pick up different languages. So coming to the area and bringing this technology, okay, what do you think, what are some of the things that you saw in new technology that exists now that we didn't have here 10, 12 years ago? As far as new technology is concerned, if that's...
Well, right now, all these technologies, it's been designed that you can take the technology anywhere you want. So that's why you don't have to go to a major city. The technology is basically simpler that we can do it in a hospital, and there's a lot of advance in imaging that we have right now. So the image quality is much better in the last 5 years than it was before. So.
The MRIs and...
The fluoroscopy, we do all these procedures on the fluoroscopy, so the technology is great.
And as far as the technology, getting back to the Greater Hazleton Health Alliance, the Alliance Medical Group, which you're a part of, when you're looking at the technology we have, do we have the technology?
We have the technology, and we're going to get better in the technology because there's a plan of expansion in the interventional part of the hospital that is going to be great.
So you're excited?
Yes.
Okay, so I was talking to Dr. Julio Calderin, folks. He joins the Alliance Surgical Group, Surgical Services, along with Dr. Butt, Dr. Bono, and we'll be talking to your wife, Dr. Dennis. And so she's a general surgeon,
yes.
Correct? So you met in residency, right?
Residency.
So who came, who said what? You went to her, or she come to you? She saw this Italian, this Puerto
you'll
Rican.
see.
Yeah, you were sitting there. There's a pretty girl, you know. And so it's funny because you have to. Sometimes I think some doctors, because of being busy, and I don't mean it disrespectful, but the bedside manner sometimes people are scared to begin with. You know, they're nervous about their health. So having a doctor who has a little personality, and I know you could probably get out of surgery that you were strained and you had to save a life, and now you have to be, Mr. Personality or Miss Personality. But I think that's important to have that camaraderie with your patient.
It's very important because it's a trust that you need to have with your doctor. So it's not a client, it's just more like a friend. You're gonna be taking care of that person, and it's a special relationship that you create.
I admire you guys, I really do, because it's a challenge. It's like having the hand of God working with you all the time. It's important because you're looking at that patient as if it was your mom, your dad, or a family member. And I think that's what people sometimes don't realize, that the doctors do feel that way. Yes. I know the doctors that I just mentioned have that. Both doctors, Mono and Butt, performed surgeries on my mom. And I saw the compassion on both of them and how they approached it and how they made my mom feel good. And that's important. I think that's very important. Yeah. Well, folks, Dr. Julio Calderin, who is a new here in the area, vascular surgeon, will be more than happy to accommodate you if you need him. The number up there is 501-6900. The Alliance Surgical Services. Please check him out first before you decide. I know some of you from the old school still say, you got to go out of town. Sometimes you have a person that you're not perfect, and sometimes a person may go into the hospital or have a surgery that didn't go well. But that's unfortunate, but that's not the norm, okay?
No. That's not the norm, and when things doesn't go well, it can happen anywhere, here in Philly and any big hospital. So the most important part is that you get a full examination and have the correct treatment for your disease.
Well, Doctor, I wish you the best of luck. You're certainly a nice person. Congratulations on coming onto the Greater Hazleton Health Alliance. Folks, Dr. Julio Calderin, vascular surgeon, brings a lot of new technology to the area. I'm excited. I'm sure a lot of people in the hospital are excited. We're going to be talking to his wife on a separate show, and she's a general surgeon. Lucky guy. I'm telling you, he gets to marry a beautiful doctor, has a beautiful child, and you're gonna do well here. I can tell you that right now.
Thank you.
Okay, 501. Folks, 501-6900, give them a call. And remember, folks, I've said this many, many times, absolutely no need to leave the area when it comes to medical, surgical, or whatever. Check the doctors we have in this area, and you'll know what I'm talking about. We'll see you next time.